Hello everyone, thank you for tuning into my video. I'm Dr. James Randolph, physical therapist, here to talk to you today about physical therapy for rotator cuff tears. This is a common injury and many times people are trying to avoid surgery, but before we get into the rehabilitation aspect, let's first talk about what the rotator cuff is. First off, it's pronounced rotator cuff. Some may say rotator cuff or rotary cuff. As physical therapists, we tend to hear a lot of variations of these two words. The rotator cuff is actually a group of 4 muscles with a common insertion onto the humerus bone. One of the more common muscles torn of the rotator cuff is the supraspinatus, this muscle right here. This can be from a traumatic injury, such as lifting something heavy and hearing or feeling a pop in the shoulder, or it can be from just general wear and tear over the years. Some people may be more susceptible to these kind of tears just due to the orientation of the bones in their shoulder joint. For instance, people may have what's called a type A, type B, or type C acromion, which can dig down into the musculature over time. Now, simply having a rotator cuff tear is not necessarily cause to go ahead and have surgery. In fact, numerous studies demonstrate that people can recover from rotator cuff tears without surgical intervention at all. That's where physical therapy typically comes in. Now, people often ask, can the tear heal? The answer is not likely. However, there are many people out there walking around with rotator cuff tears and don't even realize it because it simply doesn't cause any pain or problems. So when there is pain or limited range of motion or lack of strength, from a physical therapy perspective, we perform targeted interventions, usually through exercise, to address these deficits. As always, you should consult with a physical therapist first to learn what exercise may be most appropriate for your particular situation. One of the primary functions of the rotator cuff is external rotation. So a simple exercise to begin with is external rotation. As the arm improves, or for people who are further along in recovery, the exercises get more advanced in regards to range of motion and resistance to promote full recovery. There are times where even though the strength and mobility have returned, the pain persists, in which case a steroid injection may be offered by your physician. Other times, surgery may assist in better outcomes. Regardless, exercise is an integral part of the recovery. Thank you for watching. I'm Dr. James Randolph. If you enjoyed this video, be sure to subscribe to my YouTube channel and watch for other informative videos on physical therapy, health, and wellness.